Welcome students to the first of a couple of lectures about exercises 9 and 10, focusing on the skeleton itself and all the bones and bone markings of the skeleton. This first lecture here is just going to be kind of an overview of the major bones of the body in the axial and appendicular skeletons. And we're going to start with the axial skeleton, and we're actually going to start with the skull. So the axial skeleton, to remind ourselves, is the skull, the vertebral column, and the thoracic cage. The appendicular skeleton consists of the pectoral girdle, which helps us attach the upper limb, and the pelvic girdle, which helps us attach the lower limb. We're going to start with the skull. And the skull is actually kind of two parts. There's the cranium, which encases your brain, and then there's all the kind of facial bones that make up your facial architecture. There are 8 bones in the cranium. 2 of them are paired, so you have a right and left parietal bone that make up kind of the tops of the skull, and then a right and left temporal bone that make up the sides of the skull. The rest of the cranial bones are unpaired. You have one frontal bone that makes kind of the forehead area. The back of the skull and the underside of the skull is primarily the occipital bone, and then you have 2 very oddly shaped bones that sit deeper in the skull, the sphenoid bone and the ethmoid bone. If we look at the bones of the face, there are 14 of them, again paired right and left, many of them. So you have 2 zygomatic bones, which are your cheekbones. You have 2 maxillae. I know it actually looks like one, but they actually fuse together. It is actually 2 different maxillae that make up the upper jaw and part of the roof of your mouth. You have 2 nasal bones that make up the bridge of your nose. On the kind of medial part of the nasal cavity, you'll find the lacrimal bones. That's where your tear ducts are. The word lacrimal, the word lacrimose means sad, and of course we cry when we're sad, so hence lacrimal bones there. If you look inside the nasal cavity, you'll see several different bones. You'll actually see part of the ethmoid bone, which is one of your cranial bones. You'll also then on the sides see the inferior nasal conchae. So you have a concha here and a concha here. In the middle of the nasal cavity is one of the unpaired bones called the vomer, which divides or helps divide the nasal cavity into a right and left half. On the back of the palatine bone, on the back, excuse me, of the maxillae, the back part of the roof of your mouth are the 2 palatine bones that with the maxillae make up the whole kind of bony palate. You also then have the mandible, which is your lower jawbone. If we look at an interesting bone that is actually not considered a bone of the skull, but since it's kind of located up here in the throat, it's often studied as kind of with the skull. It is the hyoid bone. This is an interesting bone because it is the only bone in your body that doesn't connect to another bone in any way. It's mostly just connected to a bunch of cartilaginous tissues, excuse me, not cartilaginous tissues, a bunch of ligaments, a bunch of dense regular connective tissue ligaments. And essentially what it is a base for your tongue. And you want it really movable so that you can move your tongue in many different ways so that you can kind of form words and speak. There are also these little horns here where muscles will attach so that you can swallow, and also again so that you can speak. So that's the little hyoid bone. If we look at the vertebral column, you'll see that you actually have 24 total vertebrae divvied up into several different areas. So the first 7 vertebrae are cervical vertebrae. The next 12 are thoracic vertebrae. The next 5 are lumbar vertebrae, and then you typically have about 4 to 5 vertebrae that are fused as the sacrum, and then 4 vertebrae that are typically fused as the coccyx or tailbone. You may see here that The vertebral column is not straight. It is curved. It has both concave and convex curvatures. The whole purpose of the curvatures are to add more flexibility to the vertebral column. Without the curvatures, the vertebral column would be much stiffer and our range of motion would be much less. But because of the curvatures, we have that greater flexibility. There are 4 curvatures, 1, 2, 3, and 4. 2 of these we are born with. They develop in utero and they are present from the time we are born. And 2 of these we are not born with. They will not develop until an infant has reached a couple of developmental milestones. So the curvatures that we are born with are considered primary curvatures, while the curvatures that are forming and developing kind of postnatal are considered secondary curvatures. So the thoracic curvature and the sacral curvature are the 2 primary curvatures. The cervical curvature will develop first. That occurs when an infant learns to hold its head up on its own, so usually a couple months into that. And then the lumbar curvature will develop when an infant learns to walk at typically about a year old. If we look at the thoracic cage, essentially what we're looking at is the thorax plus the costal cartilages. The thorax consists of the sternum, the ribs, and then the thoracic vertebrae, because it's only the thoracic vertebrae that have ribs attached to them. None of the other vertebrae have ribs attached to them. The sternum has 3 portions. The upper portion is the manubrium. That's where the clavicle attaches. The majority of the sternum is known as the sternal body. And then this tip down here is the xiphoid process, and it is actually cartilaginous tissue. It is the very last bone in your body to ossify and will remain cartilaginous tissue well into your 50s. We have 12 pairs of ribs for 24 total. The first 7 pairs are what we call vertebral sternal or true ribs, because they attach on the vertebrae and then directly attach 1 rib, 1 piece of costal cartilage, attachment to the sternum. So a direct connection to the sternum. You then have 5 pairs of what we call vertebrochondral or false ribs, because they do not have a direct attachment to the sternum. They have an indirect attachment to the sternum. They will connect to all of these pieces of costal cartilage, and then that piece of costal cartilage will then actually attach to the sternum. And then you have 2, the last 2 pairs are considered vertebral or floating ribs, because they only attach to the vertebrae and they do not attach at all to the skeleton. If we look at the appendicular skeleton, you'll see that the pectoral girdle consists of the clavicle, which is your collarbone, and the scapula, which is your shoulder bone. The upper limb has a couple of different divisions. The arm is from the shoulder to the elbow, so there is 1 bone in the arm, that is the humerus. The forearm from the elbow down to the wrist has 2 bones, the more medial ulna and the more lateral radius, and then you have 8 carpals, 5 metacarpals. So the carpals make up the wrist, the metacarpals make up kind of the palm of the hand, and then you have 14 phalanges that make up your fingers. If you look at the lower limb, the pelvic girdle consists of the sacral part of the vertebral column and then the coxal bone or the coxa. And the coxal bones are actually 3 bones that have been fused into 1. They are the ilium, the pubis, and the ischium. They connect to the bone of the thigh, which is the femur, biggest bone in your body. Your kneecap is that sesamoid patella. And then down on the leg, we have the shin bone, which is the tibia, and then the non-weight-bearing fibula more laterally. The ankle bones are known as the tarsals. The metatarsals make up like kind of the arch or the instep of your foot, and then similar to the hand, 14 phalanges out here for your toes. And those are the major bones of the body in both the axial and appendicular skeletons.